Hi, my name's Dr. Noah Smith. I'm a general internal medicine provider and primary care physician at Michigan Medicine. One of the most important things to me when I'm seeing patients is that I develop a really trusting relationship with that person. As their primary care provider, I'm going to be their touchstone for their health for the foreseeable future, for possibly the rest of their lives. They need to be able to trust me to come to me with any concerns they have about their health. And from that, we can build a strong foundation to be able to protect their health and manage their chronic medical conditions, connect with specialists and the rest of their healthcare team. And that's really what's most important to me and what most excites me about being a primary care provider. In order to try to really build that foundation and that relationship, I really try to understand what's important to a person. You know, how many grandkids they have, what's the name of their pet, where do they live in Ann Arbor, how long have they been here, where do they work, what is important in their life that their health needs to allow them to do. And if I can understand that, then we can go forward and prevent problems, protect their health, and deal with their chronic medical conditions together, knowing that we have their values driving that ship. I really try to start all of my interviews with patients, start all of my visits with patients, one, in hearing about how they're doing, but then two, when it comes time to talk about why they're there, I am quiet. I'm listening to them for at least the first several minutes of that visit, where they're just explaining what they've been feeling, what's been going on, what has them worried, and why they're concerned. And then always at the end, making sure that they understand that we've talked about everything that they wanted to, and that they know what we're going to do next to try to address these things. And to know that we've built this community of trust between me, but also the rest of the staff in the clinic and Michigan Medicine as a whole, being the center of their care as they see other specialists throughout their life, as we all will, and knowing that I'm the person that they count on first in their healthcare. So as people are receiving care for their medical conditions, I want them to understand what's happening to them. I want people to really understand what's going on with their medical care and why we're doing something. Medicine is important in protecting the well-being of people, but we rarely have a magic bullet. And so we're often working with people step by step, slowly, to make them feel as good as they can for as long as they can. The most amazing thing about primary care is that as you get farther into your relationships with patients, everything becomes more meaningful, more important. People's health changes over time, but your relationship with them grows stronger. It becomes easier to give them advice. You have a core foundation to build on in talking about their health and how to maintain it. I'm extremely interested in preventative medicine. And the idea is that we're not here to rescue you from a bad outcome here. We're here to prevent anything bad from ever happening to you. The really strong power of evidence-based medicine to prevent things like heart attacks and strokes, things that are really impacting their quality of life. Maybe the biggest win in medicine that there is for patients is helping someone stop smoking, and that we have tools to make it much easier than they ever thought before, and knowing that they're capable of that. And then telling them how much that's going to improve their health. Their risks of cancer, heart disease, stroke plummet, and they're going to find that they're able to do more, be more than they were before.